Assalamu alaikum. Welcome to this primer titled Coronavirus and COVID-19, What You Need to Know, on behalf of Burlington Masjid, North Carolina, by Dr. Ahmed Tejan-Sie. I'm a physician in private practice at the Lance Medical Associates in Burlington, an assistant clinical professor of medicine at the University of North Carolina, Chapel Hill, and chief medical officer of Paradigm Immunotherapeutics, a biotech firm in California. Firstly, what is the novel coronavirus and COVID-19? It belongs to the same family of coronaviruses that causes a common cold, but is a newer variant, hence the term novel. It is also distinguished by the fact that it mainly attacks the lungs, often causing pneumonia. It was first identified in Wuhan, China in December 2019. The World Health Organization named the virus SARS-CoV-2, and the disease it causes coronavirus disease of 2019 or COVID-19. For simplicity, I refer to the virus as coronavirus and use the acronym COVID-19 for the rest of this presentation. So, how is the virus spread? It's spread by droplets. If you look at the diagram, the infected individual in brown is spreading droplets by various mechanisms, including coughing, sneezing, talking, and even breathing. Within 1 meter, one can be affected by large droplets either directly or by touching contaminated surfaces. The further away one is, the smaller the droplets become. These smaller microdroplets are now believed to remain airborne for 20 to 30 minutes in enclosed spaces like conference rooms, stores, or other rooms without adequate ventilation. This further reiterates what I mentioned in the previous slide and also raises the possibility of an additional mode of transmission through aerosolization of fecal droplets whenever a toilet is flushed. It is thus recommended to close the toilet lid before flushing, a shared bathroom, and avoid public restrooms. How does one protect oneself? As you can see from the slide, improving personal hygiene by washing your hands frequently or using hand sanitizer instead is paramount. Avoid touching your face, sneeze away from people, and clean surfaces frequently. Also open windows to improve ventilation when possible. Continuing in this vein, the WHO has recently added wearing of face masks in public to reduce spread from pre-symptomatic and asymptomatic individuals. Wear gloves if working with the public. Avoid touching surfaces in public spaces and items such as shopping carts or gas pump handles without prior sanitization. Also protect yourself and society by social distancing to ensure at least 6 feet between individuals. What is social distancing and how does it help everyone? Social distancing tries to keep people at least 6 feet apart to reduce the risk of transmission of the disease. National, state, and city lockdowns aim to reduce congestion, social interactions to more easily enforce this, and hopefully reduce the spread of the disease and the rate of increase. All lockdowns in the USA keep supermarkets, pharmacies, and essential businesses open. Therefore, there is no need to stockpile items. Social distancing not only helps prevent spread of the disease, but also slows the spread to lower the impact on healthcare systems. As displayed in the image, this enables us to, quote, flatten the curve, close quote, which is depicted in blue, example countries such as North Korea and Hong Kong, as opposed to rapid spikes depicted in orange, example Italy and Spain, which have very high death rates. When it spikes so rapidly, the healthcare system becomes overwhelmed and patients suffering from other conditions fail to have access to medical care such as heart attacks and motor vehicle accidents. Everyone on Earth can succumb to COVID-19 as there's no immunity in the human population. However, certain individuals are more likely to have severe complications from the illness and are termed high-risk groups. This will be elaborated on further in the next several slides. The 3 most common symptoms of COVID-19 are fever, cough, and shortness of breath. A very unique one is loss of taste and smell. Several others are listed in the slide and include other rare ones such as confusion. If you think you have COVID-19, self-isolate immediately. Instructions on how to do this can be found on the cdc.gov website. Call your health provider who will arrange testing. Go to the hospital if symptoms become worse, which would include dizziness, more severe difficulty in breathing, and chest pains. If one does suffer from full-blown infection, one can develop respiratory or lung failure, heart attacks, blood clots, kidney failure, and brain damage. Failure of multiple organs, unfortunately, can lead to death. Here, I will elaborate on high-risk groups I mentioned earlier. This slide reflects information from China and Italy and shows that people who are 50 years or older have a higher likelihood of death, rising from around 1% at age 50 to 17% at age 80. However, please remember that everyone's risk is unique and depends on their present health conditions and other diseases. This slide also highlights health conditions that increase the risk of death from COVID-19. As you can see, heart disease tops the list, followed by diabetes, then chronic respiratory disease, such as emphysema, chronic bronchitis, or even asthma, followed by hypertension and cancer. So, how do we treat this disease? Unfortunately, there isn't a proven treatment nor an approved vaccine. All current treatments are either old drugs that have been repurposed or experimental ones such as remdesivir. A safe and effective vaccine is unfortunately at least a year away. To further elaborate, chloroquine or hydroxychloroquine is the main repurposed drug with or without an antibiotic called azithromycin. Remdesivir is an experimental antiviral drug that cannot be presently prescribed. Survivor's plasma is extracted from survivors of COVID-19 and transfused into patients after appropriate screening. Only it and hydrochloroquine can be prescribed after FDA clearance presently. All therapies are currently undergoing clinical trials in several cities in the USA to determine efficacy. I will now discuss complementary or alternative medicines. Firstly, black seed, which has been described as the cure for every disease in an authentic hadith by the Prophet ﷺ, is rich in thymoquinone, which has antiviral properties. However, this time the effective dose for COVID-19 is unknown. Next, zinc is a proven treatment for the common cold, coronavirus. It reduces severity and duration of illness. However, it's unknown whether it's effective against COVID-19. Finally, Chinese herbal medicines were investigated by the Chinese authorities, but results are presently unknown. Here I've listed additional resources, namely the CDC, the FDA or Federal Drug Administration, North Carolina Department of Health, and the World Health Organization. In conclusion, COVID-19 is a new disease caused by the novel coronavirus, otherwise known as SARS-CoV-2. It chronically kills 10 to 33 times the number of flu victims. While younger patients are more likely to survive, they can still become critically ill. Nothing happens without the permission of Allah. Therefore, make dua, ask for His forgiveness, and that this scourge be lifted from us. Ameen. Thank you.